How do we define health? Well, according to the World Health Organization, the term refers to a state of complete physical, mental, and social well-being, and not merely the absence of disease. Many economic and social factors influence our health and are often overlooked. These factors are known as the social determinants of health, which can have a large impact on one's quality of life. Income is a major determinant of health. Our level of income directly impacts daily living conditions such as access to education and health services, food security, housing, transportation, and social inclusion. According to the Minnesota Department of Health, social and economic factors are the #1 determinant of an individual's health. To better understand the impact of economic factors on quality of life, let's take a quick look at the life of our friend Jack.
Jack is a 27-year-old single parent who works a physically demanding job in a local factory. He makes minimum wage working overnight shifts while his son stays with his grandparents. A problem with Jack's job is that because he doesn't have any specialized qualifications, any average Joe could fill his position and complete the same work. This was the only job Jack could get as he doesn't have any post-secondary education. Jack makes $10.50 an hour, bringing home roughly $1,600 a month before taxes. After paying for rent, utilities, and low-quality food, there is very little money left at the end of the month. Jack does not have the money for him and his child to participate in extracurricular activities such as sports, nor can he afford the cost of transportation. With little job security, he is always worried about the fact that he could end up having no way to care for himself and his child.
Like Jack, many Canadians are facing a similar reality due to their level of income. A 2011 study suggested that 1 in 7 Canadians is living in poverty. However, these difficulties are often overlooked by individuals of higher socioeconomic status not facing similar living conditions. Minimum wage jobs are often associated with high physical demands and little job security. They don't offer benefits such as health and dental insurance, which influence someone's ability to access health services. 1 in 10 Canadians cannot afford to fill their medical prescriptions. Canada is the only industrialized country in the world with a universal healthcare system, but without a national pharmacare policy. Another issue that Jack faces is food insecurity. Food insecurity is considered the inability to acquire an adequate diet in terms of quality and quantity in a socially acceptable manner. Jack's income lacks financial stability and he fails to provide a healthy diet, resulting in malnutrition. It has been said that 1 in 8 Canadian households struggle to put food on the table. These food insecurities can create health implications such as diabetes, heart disease, and high blood pressure. They can also impact an individual's psychological well-being.
Housing is another social determinant that affects Jack's health. There is a direct relationship between inadequate housing and adverse health outcomes. When discussing housing as a social determinant of health, it is important to emphasize the quality of housing which is available. To do this, we must examine the physical, social, and environmental living conditions. The physical condition of a home includes plumbing, electricity, safe drinking water, heating, and exposure to physical, biological, and chemical contaminants such as pests, allergens, or mold. There is an increased risk of respiratory illness for both children and adults in damp and moldy houses compared to those living in dry conditions. In turn, this can lead to poor health. The social and environmental conditions of housing are also important aspects affecting one's health. When considering the environmental conditions surrounding an individual's home, it is important to consider the proximity to services such as school, health services, grocery stores, and recreational areas, all of which have a direct effect on our health. Like Jack, many Canadians struggle to pay for these adequate housing services and often have to face the dilemma of whether to use their available income to pay for rent or to put food on the table.
An individual's health is influenced by a variety of factors. Gender, race, presence of disabilities, and transportation all further contribute to the vicious cycle existing with regard to social inequalities. In considering our friend Jack and his son, living in such conditions will impact their ability to overcome obstacles related to the social determinants of health.
you.